For Rebel News, I'm Tamara Ugolini in downtown Toronto at a conference center where the Canadian COVID Care Alliance has been coordinating and orchestrating the citizens hearing. And joining me here is Sonya Anderson, who is the chair of the Government Relations Committee. Thank you. And so you have been instrumental in organizing this hearing. Why did you decide to call it the citizens hearing?
Oh, there were lots of, we had a lot of people that were reaching out to us from all across Canada, sharing their stories, and we felt that nobody was listening to their voices. So we kind of liked the idea of having two different meanings to it. So the fact that we're listening, hearing their stories, but also the fact that these are not legal proceedings by any means, but that we're hoping to create the aura of this is the type of thing that we really need here in Canada. We really need to have a national inquiry, a national hearing that will listen to these stories so that we can affect change in the future.
Mm-hmm. Tell me a little bit about that committee that you chair. What's the role of it, and what do you typically do? How do you engage with government officials?
Mm-hmm. So the Canadian COVID Care Alliance, just as a little bit of background, we're all about the science and the medicine. But when I came to it, and I've been on board since meeting number 2, I'm not a scientist or a doctor, but I come from more of a citizen activist, more of a government relations type person. I really think that it's important to engage with political officials, because what most people don't understand is that at the end of the day, they're just human beings. They're just people like you and me. And what they really need is to be educated on a lot of the issues. So none of them are experts in virology or immunology. And certainly when, COVID came along, they had questions. So we had people that were reaching out to us from government, and so we decided within the CCCA to develop a government relations committee so that we could answer those types of questions. So we really try to connect government officials with scientists, doctors from across the country, and it's been fantastic. So we meet every week. We have often politicians, so we have 2 or 3 that will sit in on our meetings, and then we have some that are retired former elected parliamentarians that join us and offer some great advice, and they help us network and hopefully share this type of data and research with government officials.
I think one of the forefronts of democracy is, of course, having robust debate, scrutiny, and just conversations. And that's been so ridiculed and disregarded over the past 2 years. How have you seen the tide starting to turn, if at all, in that specific regard?
Yeah, and actually that's kind of the genesis of the Government Relations Committee. So we didn't have a Government Relations Committee for about the first 9 months of the CCCA. It was when we had politicians reaching out to us because they had questions. They had people within their own constituencies that had concerns, whether it was about the fact that they couldn't visit their family members in long-term care, or people had issues with masking, and they wanted to know the science behind all of this. So when they started reaching out to us, that's when we started realizing the tides were turning. And so we're hoping to see more of that. And we're really hoping that this citizens hearing will capture that exact thing. We want to engage with politicians. We want to work with them of any stripe and of any level. So we've worked with municipal, we've been working with senators, and so it's got to be a really robust conversation.
Yeah, I completely agree. And that's what is happening, like you've already stated here today. So this is a 3-day series. So yesterday was day 1, today is day 2, and then tomorrow. Can you give us just a brief overview of what each day, what the agenda or the itinerary of each day kind of entails?
Mm-hmm. So they are different every day. What we did, we started receiving all of these different testimonials coming in via I had a lot of phone calls. My phone was ringing off the hook, or we had people that were writing in, and we started recognizing some themes. So we tried to organize it around topics. And then what we wanted to do was package those topics to provide better depth and context with an expert and a lawyer that could speak to those. So for instance, we started day one off with students, some calling in via Zoom, others in person, that were sharing their stories about how mandates or masking issues like that have impacted them. And then we had a lawyer that could speak to that, and we had an expert that was able to speak around that issue as well. So we've tried grouping them according to those sorts of themes. This afternoon, the bulk of our presentation is going to be on vaccine injuries. This morning, we spent a lot of time with doctors that were sharing their experiences in their practices. So some that were trying to treat with early treatments and being sanctioned for that. Others that were writing exemption letters, being sanctioned for that, and others that the pardon me, the vaccine reporting system, that again, for reporting vaccine injuries, being sanctioned for that. So.
And of course, we don't want to give too much away what the tomorrow schedule and itinerary is, but if you could maybe give us, our viewers, a peek into kind of what's next, what's in store, what are the plans moving forward after you finalize the day tomorrow?
So a couple things, and I'll share with you a bit about tomorrow. Tomorrow, we have two main things going on. So we have a cross-partisan, multi-level government relations roundtable. And during that roundtable, I reached out to two MPs from each of the four major parties. I reached out to two senators, two MPP or MLAs, and two municipal councillors, because we wanted to get a real broad cross-section of politics across Canada. And we asked them three questions. So the first question was, what sort of impacts are you seeing from your constituents as a result of COVID? Second question was, how have you helped them overcome any of those challenges? And then the third question is, what do you recommend going forward that could help minimize those challenges that your constituents have faced, or could completely eliminate them? So we're hoping to get a really nice round table, nonpartisan discussion going there, so that people can, the whole point of it is solutions. We really want government should be about working together to find proper solutions for their constituents. Then in the afternoon, we're going to take the recommendations from our three panelists that we've had over the course of the 3 days, and they've been listening to testimony, asking questions, and they're going to take those recommendations. And we have, in addition to those three panelists, we have other members that will be Zooming in or will be here live that are part of our Next Steps task force. And their job is to take those recommendations and work on a framework to carry this forward, because this is just the start of something so much bigger that needs to happen.
And I think that's a really important point to leave off on for Canadians, that there are a lot of really crucial, influential people working here on getting this sort of framework and having this robust discussion and debate. And so, I've already mentioned in the interview, the tides are starting to turn, and it's just picking up momentum. And I think that there is a great opportunity here for a snowball effect to be taking place. So please stay tuned on my reports, and you can follow the Canadian COVID Care Alliance on their website and their social media platforms as well. For Rebel News in Toronto, Ontario, I'm Tamara Ugolini. Following the China-centric pandemic response of Xi Jinping was an inept failure, and the citizens' hearing discussing the failures and fallouts of that very same response that was never based on evidence or sound science. And yet the World Health Organization wants to strengthen its mandate and member states under pandemic treaties and international health regulations. That could have effect on the way we respond to pandemics in the future. To sign our petition against these treaties and legally binding health regulations, head over to nopandemicctreaty.com. You can sign the petition there and stay up to date with all of our reports on the subject. That website again is nopandemicctreaty.com.